So today's word of the day is in Hungarian, and I'm very new to Hungarian, so I'm sorry if I get this wrong. If anyone wants to correct me, I am willing to get corrected in the comments. If you can write it in IPA, I do know how to read IPA and that's International Phonetic Alphabet. That will help me a lot because right now it's mostly like I'll listen to it and I'll have to try and hear it, but so, today's word of the day is Kórház. This is the Hungarian word for hospital, and it's spelled K-O with the accent. And if you know Irish, it's the same accent as a fada. If you know French, it's the same as an accent aigu. It's the one where you go Alt-E on a standard Canadian English keyboard, and I believe it is also Alt-E on British English and American keyboard. K-O with the accent, R, H, A with the accent, and then Z. So, Kórház. And it means hospital. Okay, back on topic. So today's video is coming out on, it's Friday at 6 o'clock, I'm making it right now. And I never announced a schedule, so it can't be late. It's late. But anyway, yesterday I was going to make a video and I tried to make a video, but it was really I just gave up because so I went to the States to see my brother and his kids and his wife. But then when I came back up on Thursday and I had a doctor's appointment. So I came back up, went to a doctor's appointment, and then I was here and I hadn't showered and I was gross and I was tired and I tried to film something sort of off the bat and I was like, this is terrible, and then I tried to edit it, and then it crashed, and then I lost all my footage, and I was like, you know what? Not doing this today, I'm doing it tomorrow. So now is a much better day to do it because I have the house to myself. I'm sorry that there's the light. I'm trying to set it, I've been trying to set it up in a way that the light doesn't bounce off my glasses, but it's basically impossible because either it bounces off my glasses or I'm not lit. So, part of that is because I only have the lighting around my house. I don't really have any specific lighting. So if I had lighting that was for filming, it would be easier, but at the moment I have to work with what I have, so you're gonna have to deal with blotches of light in my glasses. Anyway, so I was in the States, and today's gonna be sort of a rant, and it's gonna be sort of political, so just be warned. I am very leftist. I am a socialist. So if you have problems with that, feel free to leave. If you want to listen anyway and have a debate, a proper, caring debate, because I don't want to be just attacked. But if you want to talk about your opinions, I'm totally up for that. But keep in mind that this isn't a black and white factual debate. This would be a debate on opinions, so yeah. So anyway, when I was in the States, one of the things that's been going on with me, part of the reason why I have been making videos very, very, very sporadically since I first started making them, because I did go through a stint where I was making them fairly regularly, even though I didn't really have very good access to a computer. I didn't really have the resources to do it regularly, but I was sort of managing, and then I dropped off, and that would be mostly for health-related reasons. So my health is a big fun grab bag of question marks, I think, would be a good description of my health anyway. One of the things with my health right now is I'm on a low priority waiting list for an MRI. So, in a couple of months, probably after the fall, so probably sometime around Christmas or after Christmas and New Year's area, I'm going to be getting an MRI for diagnostic reasons, because that's what MRIs are for, their imaging equipment. I told someone that, and they said, well, if you were in the States, you'd have an MRI by now. I'm so frustrated by it. I sort of need to go through why I appreciate my healthcare system, my problems with my healthcare system, and why I completely disagree with her premise. So first off, she said, well, if you went to the ER, you'd get an MRI. And I'm like, okay, but if I went to the ER in Canada, I'd get an MRI. But I don't want to go to the ER. I'm not at the point where I need to go to the ER. I'm like, it's uncomfortable, it's preventing me from working, but it's not an emergency. I don't need an ambulance to come. I don't need to go to the ER. So I didn't go to the ER in Canada. I went to my GP. My GP referred me to a specialist. I actually went through 3 specialists. And now I'm on the waiting list for an MRI. But that's very similar to what you would do in America if you didn't go through the ER. So if you went to your GP in America and you said, you know, I have this problem and it's kind of interfering with my ability to work or go to school or whatever, they would say, okay, well, I'm probably going to send you to a rheumatologist or someone else of that type. And, you know, you might deal with a couple of sexist ones, because that's something I've been struggling with in the healthcare system, is doctors are sexist, but that doesn't change across the border. And then you'll find someone who will be less sexist or racist or whatever, depending on what sort of situations you are at in your life and what doctors can use against you to not treat you. And once you get to someone who is a good doctor, then you'll be scheduled for whatever tests is needed. I don't understand why the idea of getting an MRI any sooner is better, because I guess I have a different sense of that. I think it has to do with a different attitude towards the wait. Canada has wait times. Canada has had and will probably have in the future very bad wait times at certain hospitals in certain periods or for certain types of procedures. That's not a standard. Our wait times are not as bad as people think, but there are times when you'll go into the ER and there'll be somebody else there who's higher priority who takes all the doctors and you gotta wait. When I broke my arm as a kid, I went to Children's Hospital because it's not too far from my house. And when I went there, we were waiting, and we got to the point where one of the nurses came out and said, you know, there's a little kid who has a really high fever, and all the doctors are working on this kid because they're priority. And, you know, we're probably not going to get to you till the morning, so if you want, I'll make sure it's wrapped up enough. You can go home, sleep at home, eat a little bit, but don't eat past this time so that when you come back in the morning, we'll hold your space. But we'll tell you, like, we're not going to make you sleep in the hospital overnight when that's not what you need. So, you know, I've had those days where they can't set your arm until a day later, but it's not a regular thing. It's, we have a major emergency, and this isn't standard, like, we really need to deal with this. We've got every doctor working on that. And I can't imagine being in a position where I would be upset about that, because I'm like, yeah, I want you to save that kid's life. I'm not going to die from this arm. You know, that kid really needs you. And, like, I don't understand this idea that, well, but I don't want to wait. Like, I just don't get it. And there are other times where my mom was on a waiting list for a hernia surgery and ended up going in for emergency surgery because the waiting list was too long for what she was able to wait for. But when it got to the point where it was an emergency, she was rushed in for an emergency surgery. So, like, you still get if once you become a priority, you get to go in as a priority. So, I guess I grew up with it and I'm used to it. It's what I consider fair, and maybe other people don't consider it fair. And, you know, I would probably be pro getting more equipment and more nurses, especially in BC. We've got a nurse shortage for sure. And, you know, maybe more doctors and maybe better training in terms of sexism and prejudice for the doctors, because it's very frustrating to be on a waiting list for a doctor, find out that they're not really going to help you because they don't believe that you're really sick, and then you have to go to another doctor. That's frustrating, especially when you have to wait for every single one. But that's not a problem with the wait, it's a problem with the doctor who like would get in to see after the wait. I feel like I'm ranting and babbling, and I probably am, but I've just been so upset about how everything was with this. So one of the things I really like about the Canadian system is that anyone who wants to help it, even if it's just for themselves, has to help everyone. So I don't know if any of you know about the really popular band, the Tragically Hip. They're like a quintessentially Canadian band, and they just did their farewell tour. Now, Gordon Downey Jr., the lead singer of the band, was diagnosed with brain cancer, and he is donating his money in Ontario for a new brain cancer research type thing in the hospital. Now, it might not benefit him. He might die before it's built and starts creating innovation. We don't know. But that will help every single Canadian. If there is another Canadian who has brain cancer that can be helped by that facility, all Canadians have access to it. And if you're American and you donate your money to a center for whatever disease you have at the hospital that's close to you, not every person in the country has access to that if they need it. Like, I like the fairness, I guess. I like the evenness, and I like that everyone is incentivized to try and make the healthcare system better for everyone because it is universal. Now, there are things I want to change about the Canadian healthcare system. There are things that are so frustrating about the Canadian system in general, but none of them I want to change by making us a tiered system. There are people who would disagree with me on this. There are Canadians who want to have a private option, which makes sense because we are one of only 2 countries that don't have a private option. So, yeah, I get it. Everyone else does, but I don't necessarily agree with that because I think the private option just creates a class divide into people who can pay and people who can't. So since this was super political, I'm gonna go get my cat. A lot of people like looking at cute pets, so yeah. She's tubby. Hey Bella! Bella, say hi! Say hi to the people! Say hi to the 5 people who are watching. Say hi! Yeah. This is my cat Bella. She's not happy because it's hot. Yeah, it's hot. She's tubby. See? Big tubby cat.